All right, so the first question here is in a previous YouTube video, I'd mentioned something involving 18 and 8. So I don't know. But I will say the numbers that I typically remember for, if we're talking about like the weight-based heparin protocol, would be 100 or to divide by 1,000 for the bolus and divide by 100 for the IV drip. So I'm not sure what 18 and 8 are referring to. The only numbers that are constants essentially in the heparin protocol is that your bolus dose, once you multiply the patient's weight in kilograms by the 80 units per kilogram, then you divide by 1,000. That'll give you the milliliter bolus. And then for the flow rate question, or the infusion part of the weight-based protocol, again, take the patient's weight in kilograms times 18 units per kilogram per hour, and maybe that's where the 18 is coming in, and then you divide by 100. So I apologize, but I do not know what the 8 is referring to. We can figure out the 18, but that's stated in the protocol. All right. So what I've been telling the 240 students is that, you've seen this before. It's pretty much a very similar test that you had for 230. The difference is I think you have one more heparin infusion question and one less insulin infusion question, but you're still going to see a heparin protocol question. You're still going to see the things that are all listed on the blueprint. The one thing that might be a little bit different is you might see a question that looks like this. So I've been told that there's the potential that you might see an alternative label for your reconstitution type questions. And this is what that label looks like. So this is an example of a reconstitution medication. What a reconstitution is a powdered medication that in the pharmacy or in certain clinical settings, you're going to add water to in order to make it so it can be injected. And so in this example, in this scenario, you have this medication Ancef, which looks pretty much like any other regular medication level, but because you know that it's an injectable and it's intramuscular, one of the things that's missing here is the milliliters. So it just says 500 milligrams. So in this type of label, you need to know, and this is why I'm showing it to you and telling you, you need to know that you have to go over here to the instructions, look at the instructions, and see what the actual strength of this medication is. And so what this will tell you is it'll go through, it'll say for intramuscular administration, you're going to add 2 milliliters of sterile water. You're going to shake it up. Then you're going to withdraw the entire contents, and the entire contents, after you add water, in addition to the powder that's there, you're going to have a total volume of approximately 2.2 milliliters. Now, if they didn't give you the strength, and they do in the parentheses right next to that 2.2 milliliters, you would use that. You would take 500 milligrams divided by 2.2 milliliters. That would be your concentration or your strength of this particular medication. But you don't need to worry about doing that because it tells you specifically that once you add the 2 milliliters of sterile water, that will bring you to a concentration of 225 milligrams per milliliter. So that's what you're looking for. You have to look for it on this particular label, which is a little bit different. And just letting you know what that looks like, just in case you see it. I don't know if you will or will not, but I feel like if you get this question and you're like, how do I figure out how many milliliters to administer? Now you know at least where to look. You're going to look in the label. So you might see a question like this on ATI, maybe on NCLEX, potentially on your drug calc test as part of your reconstitution questions. So just letting you know. All right. So I've worked through a couple of these heparin protocols. So if you go back and look at the Tuesday review that I did for 240, I did a couple of these heparin workthroughs. And then what I'm going to do is I'm going to do what I did with the 230 class. I'm going to create a new scenario, and then I'm going to have you answer a portion of it. All right. So, oh, it looks like this is relatively blank. So that's good. This is actually good to work off of. All right, so I changed the patient's weight here to 230 pounds. So I'm just going to leave it as the 230-pound answer. And maybe the 18 and 8, maybe it was referencing 80 and 18. Well, I actually just worked through the reconstitution. So I'll just tell you right now, all you have to do is, the trick is just finding this 225 milligrams per milliliter. And then once you do that, then you just do ordered over available. So I don't think that that's going to change anything. It's reconstitution is just the same as an oral or parenteral type of medication. You're just doing, if you do order over available, that's all it is. Just make sure you multiply by quantity. All right. So for your heparin protocol, so in your heparin protocol, as a reminder, you've seen this before, you know that there's a lot of wording here, and basically it's just like what would be posted up on the poster, up on the wall, or a sheet off to the side, basically saying this is the protocol. So you don't need to worry about answering all these questions, which is why I crossed everything out. You just need to worry about answering the questions below. Calculate the bolus, calculate the initial infusion rate. That would be one question. So you'd have to do a bolus and infusion rate, and that would be the answer of one question. Another scenario is you might get, the patient's already been under protocol, and they retest his clotting time, his or her clotting time, and then we get two different orders here. And you can then go from, then you would recalculate a new bolus, recalculate a new infusion rate. So I actually worked through and I did a different scenario here, and I basically just trimmed down. I got rid of all the protocol stuff. So I'll leave this here. This is what I did on Tuesday, and I'll go through the one with the 230 pounds here right now. But if you wanted to see where I've worked through some of these already. Okay, so for this one, patient's 230 pounds. Step one is we need to convert pounds to kilograms. So I'm going to get a weight of 104.5454 repeating. So I'm just going to say 104.5 kilograms. The first question says, what's my bolus in milliliters? So I have my patient that weighs 104.5. And then what is my order? So my order is what I'm going to bolus with, and then what I'm going to start my drip rate with. So I have a feeling that the 18 and 8 that you referenced earlier was actually 80 and 18, and that's just the order. Okay, so that's most likely, now that I'm thinking about what I said, is that this is the standard weight-based protocol. So if you type in heparin protocol in Google, you're going to see this protocol written up as it is. You're going to see this standard heparin, standard bolus dosage strength, standard order to start, and then all the different subcategories to do after you've assessed their clotting time. Okay. So what we're going to do is we're going to take the patient's weight, 104.5, and we're just going to multiply by the order, which is 80 units per kilogram. 80 times 104.5 will give me 8,360 units. The next thing is we need to convert this to milliliters because it tells us we need milliliters. So I need to have a way to convert units to milliliters. So I go to my available. My available for my bolus dosage strength is 1,000 units per milliliter. So 1,000 with the units, 1 milliliter, units cancel. And then I get, after I round it, 8.4 milliliters. So the only thing that really changes for this is the patient's weight. You're always going to multiply by 80, divide by 1,000 when you're calculating the initial bolus. Let's do the infusion now. The infusion is 104 or patient is weight in kilograms is 104.5. The order says to start them on 18 units per kilogram per hour. (104.5) times 18 gives me 1,881 units per hour. And this should look familiar because this is what you did with your infusions, right? So you had heparin infusing at 500 units per hour, convert it to flow rate in milliliters per hour, or an insulin infusion where it's 5 units per hour, and then you're going to increase, or you want to know what that is in milliliters per hour. So you're doing the same thing, and you're going to need the same information. You're going to need a way to convert units to milliliters. Now, in the past, I've seen people do this. They go right back to the bolus dose, but we're not talking about bolus anymore. We're talking about the IV. So we're going to use the heparin 25,000 units in 250 milliliters, half normal saline. So we're not going to use the bolus dose. We're only going to use the bolus dose for bolus calculations. We will use the IV for doing the infusion rate. So the volume or the units was 25,000. And then 250 ml. So that relationship is 1/100. You don't have to memorize that. I've just been doing this for too long, and so I have it memorized. And then I'm going to get an answer of 18.8 milliliters per hour. I've also been telling students that technically you are supposed to round to nearest tenth. That would also include your infusion rate. Could you plug in 18.8 milliliters per hour on an infusion pump? Maybe not, but the math is correct when we're rounding to the nearest tenth. The deviation from that is if you're doing a drop rate question, drops per minute, we know definitively that you can't give somebody a partial drop, which is why you round to the nearest whole drop. All right. Now, what I'm going to have you do is I'm going to have you spend a little bit of time and do the next 2 steps, the new bolus and the new rate. I'm going to have you do those, and then I'm going to give you a few minutes just to kind of work on it and get to the answer. So remember, I'll give you the information here that it tells us to do. So we have our patient's weight is still 104.5 kilograms. Our new bolus dose is 40 units per kilogram. And we are supposed to increase our infusion rate by 2 units per kilogram per hour. So go ahead and spend just a few minutes and do the bolus calculation and do the infusion rate calculation, and then just you could submit your answers on the chat and either do it as a direct message if you don't want to necessarily share, or just go ahead and share it with everyone we're all in this together to try and solve this anyways. So don't, I'd rather you get a wrong answer here than on your test. So go ahead and work on that. All right, good. So it looks like most everyone's getting what I got, which is 4.2 milliliters for the bolus and 20.9 milliliters per hour for the infusion. So I'm going to write that here just so if you come back to this document, you can see that it's there. So 4.2 milliliters is that one, and then 20.9 ml per hour for that one. And then, like I said, I created a separate one using 185 pounds. What I always tell students to do is to practice these heparin protocols. Like I said, the only thing that changes is the patient's weight and maybe the APTT. And then you just follow the directions as it's stated in the APTT. If you want to challenge yourself, just put in a different weight and get to your answer for the bolus and the heparin drip, or the infusion rate, milliliters per hour. And if you want me to double check, just tell me what weight you did and then what your final answers are, and then I can confirm that for you. But that's kind of the trick with heparin, is just realizing that the hard part is just remembering to use the bolus dose information, use the heparin IV information for the flow rate, and once you do that, and if you do it enough times, it'll most likely become automatic. All right. So Mina, just let me know, is this the question you're referring to, the dopamine infusion question?
Yes, please.
Okay. So you can see that I have it worked out here for you already.
Oh, yeah.
But I will, I'll go ahead and I'm going to delete this and then I'll work through it.
That's okay. What was I doing wrong? Let me see.
So
That's
the thing that I find that most people have that do this one, or at least have difficulty with this one, is that they forget to convert micrograms to milligrams
I
and the
did that.
minutes
Oh, you know what? The only thing I didn't do it is the time. That's why
minutes
it's
to
in the
hours. Yeah.
minute. I was getting in the answer that I got was mm,
Could you go over
Probably.
it anyway, Dr. Rad?
Sure.
um
So here, let me just I'll just start it over here. All right. So first of all, I think the answer to this question, at least in the key, it says 13.125 milliliters per hour. The answer should be 13.1. So I don't know why it was left at 125.
okay.
So if you see that, so this is just a question that has to do with a lot of conversions. So it's like a multi-step question. It's not necessarily challenging, it's just time consuming because it's kind of a long question. And you're going from one flow rate, micrograms per kilogram per minute, to another flow rate, milliliters per hour. So that's why it's considered an infusion. So what we're going to do is make sure I'm still live. Okay, good. We're going to start off by first accounting for the patient's weight. So when I do this stepwise, I always like to get rid of this kilogram portion of it first. So this is 5 micrograms kilogram per minute. So we can get rid of the kilograms right off the bat. And so now my infusion is 350 microgram. I'm sorry. Yeah, is that right? 70 times 5. Yeah, 350 micrograms per minute. From there, you can do any step that you prefer. So you can convert minutes to hours next. You can convert micrograms to milligrams next. And you might be wondering, well, why are we converting micrograms to milligrams? Well, you're order is in micrograms, but your available is in milligrams. So they need to both be the same in order to make that conversion. So it's really up to you what you decide to do. What I'm going to do is I'm choosing to convert micrograms to milligrams. Now I'm showing my step, but you don't have to. If you just want to write 0.35 milligrams and then be done with it, you're good. But I'm just going to write my step. And then I'm going to get, well, some people like to just continue on. I would continue on. I would just make up all my variables, but I'm just going to do it stepwise. So 0.35 milligrams per minute. Then I might want to go ahead and convert minutes to hours. It's completely up to you. Just make sure you do it. So 60 times 0.35 gives me 21 milligrams per hour. And then now you're just converting milligrams to milliliters using what we have available. I have 400 milligrams of dopamine in 250 ml. So 21 times 250 gives me 5,250 divided by 400. And I get the 13.125, but your answer should just be rounded to 13.1 milliliters per hour. So I always say there's more than one way to answer these questions. If you don't like the way I did it, that's fine. Just as long as you're getting the same answer, you're doing it right. So don't look at my work as the end all be all. It's just a way to get to an answer.
Mina, I think your mic is still on.
Yes. Yeah, what I did was I converted first to micrograms to milligrams, which I got 0.05 times 70, which I got 0.35, and then 0.35 milligrams over minute divide by 400 mg times 250 ml. The only thing I was not doing was converting that minute with 60 minute to hour. That is when I got it wrong, but I got it now.
Okay, great. All right. Is this the same number 16 that you have?
Yes.
Okay. So here, let me just clear out my. So I preemptively crossed out the extra information. That just tells the 500 milliliters just tells us how much we have total. But when we're doing it's also the same thing if I told you we had 400 or 45 milligrams of dopamine in a 250 ml dextrose 5% water, that just tells us what we have available. But when we're calculating flow rate, we really don't care about what's available. We just care about volume over time. And then if there's a drop factor involved, then we care about converting that volume over time into our drop rate. So if you've heard me review before, I always tell students to calculate your drop rate, you need two pieces of information: flow rate times your drop factor. That equals your drop rate. Your flow rate, you want to be in milliliters per minute. Your drop factor will be given to you is drops per milliliter. And your drop rate is what you're looking for is drops per minute. So one of the things that I do when I see like 120 milliliters per hour, I just automatically convert hours to minutes. So the way I would write this question is I would say 120 milliliters over 60 minutes. And the reason I'm doing that is just because it saves me a step, so I don't have to do that conversion later. I'm just going to automatically convert hours to minutes. It saves us a step. Then I multiply that by the 15 drops per milliliter. And I get 30 drops per minute. And in case you ever run across a question on ATI or NCLEX that says something about microtubing, microtubing has a drop factor of 60, like 60 minutes in an hour, 60 drops per milliliter, just in case you were to see something like that.
Thank you.
You're welcome. All right, so. All right, so for 15, we're looking at doing a calculation for hours to minutes. And so I actually created a separate problem down here. So I'll go ahead and I'll work through this one too. So when you do this, some of them will end and it'll be an exact time, so you don't have to do too much calculations, but I'm going to show you how to do this without if you get like a decimal answer, I'll show you how to do that. So you're starting off with 420 cc's, which is the same thing as milliliters. Okay. And we're infusing at 120 cc's per hour. So what I'm trying to do is get rid of cc's and get hours. So 120 cc's per hour. So 420 divided by 120 gives me 3.5 hours. So we know that that is 3 hours, 30 minutes. What I did down here was to demonstrate what to do if you got something like 1.6 hours. You would take the 0.6, because you know it's 1 hour. You would take that 0.6, multiply by 60, and that would give you 36, which is the time, 36 minutes. Alternatively, I wrote out if you just calculated down to the minute, then you can subtract 60 minutes, which is an hour, and then you're left with 36 minutes. The only challenge with that is if you do that for something that's like 4, 5, 6 hours, then you have a big minute situation. So if you do this here where you do 0.6, you take the decimal times 60, that will tell you, and all I did here was this is 0.6 hours, 60 minutes per hour. I just did a conversion.
Thank you.
You're welcome.